Hi guys, Dr. Stuart Ward, chiropractor at Resilient Health, here again with another movement health vital sign. And today we're talking about hip mobility in general. So last video, and if you haven't already seen that video, it is on the channel. It should pop up right here. We talked about hip flexion and spending too much time in hip flexion. Today, we're talking about these other elements of hip mobility. Hips are really important because they will attach into the hip socket, which is where our low back attaches into. So it's a symphony, it's a concert. All the different parts of the orchestra need to play their role, and if any one bit is maybe not pulling their weight or is playing too loud or too soft, the symphony doesn't sound right. And then for us, that might equal pain. So how do we check in on that? So last time we had the Thomas test for hip extension, and today we have the FABER test. FABER is an acronym: flexion, abduction, and external rotation. So what this lets us see is, do you have enough of this range of motion? And if you don't, what's maybe stopping it? What's not happy? So all we're gonna do from this lovely little shot that I prepared earlier is you're gonna have a lie down on your back, and you're going to try and put the portion of the inside portion of your foot, and you're going to lay it on your opposite knee, like you do in the old school Ric Flair figure 4, and just let your leg drop down. From there, what you're going to see, you should be about 2 fists away. So if you put your 2 fists together like ice cream cones, and then you should see that's the distance approximately you should be off the table in this case, or the ground, or your bed. Bed's a great place to do this. So the other one to be aware of is, does it hurt? Does it hurt anywhere? Do you feel tight anywhere? So what we're going to do in these next little bits is show you some different stretches to attack the flexion element. If you may be a bit lacking a little bit of flexion, you may be a bit stiff. Abduction, maybe a bit tight in your groin and your adductors, and your hip extension, external rotation. All right, so next position, just to work in that groin again, is a little bit of a half Cossack or a lunging half lunge. So I can just have my leg out, and I can drop down a little bit like that. This might be the one we've all done at school, where I'm coming across into my hip. And then I can also do this sort of half frog, half Cossack, where I've got my leg up or I've got it out, and I'm sort of just dropping back my butt towards my heels. I can hang out like this, and I can come up and just feel a bit of a stretch. Just go to where you feel comfy, hang out, breathe, and then we're working through that hip and that groin, trying to get some of those adductors to be less tight. All right, so we talked about abduction. Next we're going to talk about is that rotation positions. When you're in that FABER, we've got to have that external rotation. So one of those ones, classic one that will get blocked up with that is your glute. So a great one for that is, again, another yoga pose, pigeon. Now, pigeon can be a little bit scary, but we just work with where is comfortable. So whichever leg you're going to work on, that one's at the front, and you just sort of bring it up in front to wherever you feel comfy. You can just hang out like this, or you can go over it a little bit more. This would be a tall pigeon, and I can go into a lower one, and this is a low pigeon, and you just hang out and stretch, trying to work on that rotation position of your hip. If you need a little bit more work, you can bring it into a position, so you can start in that nice position and just hang out here and try and drop down a little bit more as you start to stretch through. All right, so that's it. That's our second movement health vital sign for your back, hip mobility in general. Give the FABER a go, see how you went, see is there a difference between left and right. If there isn't, maybe that's why we're getting a little bit of pain or stiffness in that hip or in that back. Feel free to attack it and see if things change. Let us know how you go, sound off in the comments below, and we'll see you on the channel next time for more movement health vital signs. See you next time, bye.